Hi, my name is Dr. Damien Clement, and Jordan asked me to speak in a psychosocial class on a number of issues because I'm an expert, or she deems me to be an expert in the area. Just to give you a little bit of a background of who I am, my name, as I said, is Dr. Damien Clement. I'm Associate Professor in Sport and Exercise Psychology and Athletic Training at West Virginia University. I got my undergraduate degree at the University of Charleston in athletic training, and I also got a master's degree in community counseling, a master's degree in sport and exercise psychology, and a PhD in sport and exercise psychology at West Virginia University. Here at West Virginia University, I teach in the graduate athletic training program and the undergraduate and graduate sport and exercise psychology program. My primary area of research is the psychological aspect of sport injury. Thus the reason why Jordan wanted me to speak in your class. Now, one of the things I wanted to at least let you know from a practical standpoint, as an athletic trainer, a physical therapist, or occupational therapist, communication with your athletes or clients is very, very, very important. One of the things I always want you to do when that client walks into the door is to get an idea of who that client is. I want you to initially develop a relationship with that person, so he or she is not just the injury that you're treating. You need to find out, what does that injury mean to that individual? What is that injury preventing them from participating in? Because if you can get a better understanding of what that injury means to that individual, you're going to be able to more efficiently work with that individual. Another things that you need to also be respectful of is the fact that each individual can't use a cookie-cutter communication strategies. You need to get to know that person so you can cater your communication strategies to that particular individual and their situation. Now, I know you should have read one of my articles, Athletes' Expectations of their Injury Rehabilitation. Couple of things you need to remember from that. Males and females are going to approach their rehabilitation very differently. So you're going to need to cater your approach to these individuals differently. Females are probably going to want more of that nurturing environment, nurturing supportive environment, whereas males are probably going to want to have more of that structured environment. They want to know what needs to be done, and they're going to try to get it done. So with regards to your communication strategies, males and females, you're going to need to approach them a little bit differently to cater your rehabilitation to ensure that their needs are being met. Above all, I think communicating with your athletes and clients and patients is very important. Getting to know them so you can better understand what they need, so you can be the most effective practitioner that you can possibly be. Hope this was helpful. Thank you very much.